Hey, it's Roberto Miki again, and we've got another question of the week. It's September 24th, 2024, and this is question number 11 in a series of questions that we're producing for the medical student, resident, or fellow studying for the boards and or in training exams. So the question is, which pulley should be preserved during flexor tendon repairs? A, A1, B, A2, C, A3, D, C1, or E, C2? Here's your chance to pause and think about the question. During a flexor tendon repair, the A2 and A4 pulleys should be preserved to avoid bowstringing. Easy way to remember which pulleys are where is that the odd pulleys A1, A3, and A5 are found over the joints. The metacarpophalangeal joint for the A1, the proximal interphalangeal joint for the A3, and the distal interphalangeal joint for the A5 pulley. The A2 pulley is found over the proximal phalanx, and the A4 pulley is found over the middle phalanx. The A1 pulley is often released in trigger finger releases. So the answer to the question is B, A2 pulley. Thanks for watching, and we'll see you on the next one.